Hello, parents, and welcome back to our channel. I'm so happy to have you here today because we're going to talk about something that seems simple, but actually can be very tricky. That is how to clean your child's ears safely. Now, ear health is not always the first thing we think about when we talk about children's health. We often think about nutrition, about strong bones, about good sleep, about teeth and brushing. But ears, we don't pay much attention until there is a problem. And yet the ears are so important. They are not only the organs that allow your child to hear, they also play a huge role in learning, in communication, and in overall development. A child who hears well can learn to speak clearly, can pay attention in school, and can connect with the people around them. But a child who struggles with hearing may face many challenges, from learning difficulties to social isolation. Here's something surprising. Many ear problems in children don't come from illness alone. They often come from the way we take care of their ears at home. And sometimes, with the best intentions, parents may do things that actually cause harm. So in today's video, I want to share with you some simple and safe tips for cleaning children's ears. Tips that will help you protect your child's hearing without taking unnecessary risks. Let's start with the very first and most important tip. Tip 1. Avoid using cotton swabs inside the ear canal. This is by far the #1 mistake parents make. You probably have cotton swabs in your bathroom right now, and you may have used them to clean your child's ears, thinking that you're keeping them clean and healthy. But here's the truth. Cotton swabs are not safe to use inside the ear canal. Why? Because of the way our ears are designed. The ear canal is narrow and delicate. At the end of the canal is the eardrum, a very thin and sensitive membrane. When you insert a cotton swab, even gently, you can push the earwax deeper into the canal. This makes it harder for the wax to come out naturally. Over time, the wax builds up, forming a blockage called an impaction. This can cause discomfort, reduced hearing, and sometimes pain. And that's not the worst-case scenario. If you insert the swab too deeply, you risk scratching the delicate skin inside the ear or even puncturing the eardrum. A ruptured eardrum is painful, can cause temporary hearing loss, and may require medical treatment to heal. Now you might be wondering, but isn't earwax dirty? Don't I need to remove it? This is a very common belief, but it's not quite true. Earwax actually serves a purpose. It protects the ear canal by trapping dust, dirt, and bacteria, keeping them from going deeper inside. It also keeps the ear canal moist and healthy. Without earwax, the ear canal would be dry, itchy, and more vulnerable to infection. So what should you do instead? The answer is simple. Only clean the outside. If you see wax near the opening of the ear, you can gently wipe it away with a soft cloth or tissue. That's enough. Most of the time, the ear will clean itself naturally. If your child has a lot of earwax or if it seems to be causing a problem, the safest choice is to ask a doctor for help. Doctors have the right tools and training to remove earwax safely without hurting the ear. So remember, cotton swabs are for cleaning the outer ear only, never inside. Tip 2. Keep ears dry after bathing or swimming. Now let's talk about water. Children love to swim, and of course they take baths every day. Water is great fun, but when it gets trapped inside the ear, it can lead to problems. When moisture stays in the ear canal, it creates a warm, dark, and damp environment. And that is exactly what bacteria and fungi love. This can cause an infection called swimmer's ear. If your child has ever had this, you know how uncomfortable it can be. Their ear may hurt, itch, look red, and sometimes even leak fluid. The good news is that preventing this is simple. After swimming or bathing, just make sure your child's ears are dry. You can use a towel to gently pat the outside of the ears. You can also encourage your child to tilt their head to each side to let any water drain out. Some parents even teach their children a little shake the head game after swimming to make sure the ears feel light and dry. But here's an important reminder. Don't use sharp objects, cotton swabs, or your fingers to try to get the water out. That can actually push the water deeper or cause injuries. Just let gravity and a towel do the work. A small habit like drying the ears after water play can save your child from a lot of pain and doctor visits. Tip 3. Use ear drops only when recommended by a doctor. Sometimes, despite our best efforts, children may have a buildup of earwax that makes them uncomfortable. In those cases, a doctor might recommend special eardrops to soften the wax. These drops help the wax come out more easily and safely. But here's the key. Don't use eardrops unless a doctor advises you to. Not all drops are safe for every child. For example, if your child has an ear infection or a small hole in the eardrum, some drops can make the problem worse. So if you suspect that your child's ears are blocked with too much wax, don't reach for random products at the pharmacy. Instead, make an appointment with your pediatrician or an ear, nose, and throat specialist. They can examine the ear and tell you the safest way to proceed. Remember, every child's ear is different. What works for one may not be safe for another. That's why professional advice is so important. Tip 4. Watch for warning signs. One of the most important things you can do as a parent is to pay attention. Ear problems don't always come with obvious pain. Sometimes the signs are more subtle. For example, does your child often say, "What?" when you speak to them? Do they ask you to repeat yourself? Do they turn up the television or tablet volume louder than you think is normal? Do they sometimes ignore you when you call, not because they're being stubborn, but because they simply didn't hear? These could all be signs that your child is having trouble hearing. Another warning sign is if your child tugs or pulls on their ears often, complains of itching, or if you notice any fluid coming out of the ear. Don't ignore these signals. They may not always mean something serious, but they are definitely worth checking with a doctor. The earlier you identify a problem, the easier it is to treat. Tip 5. Schedule regular ear checkups. Finally, one of the best ways to keep your child's ears healthy is through regular checkups. Most pediatricians will check the ears during routine visits, but you can also ask specifically for an ear check if you are concerned. A doctor can use a special instrument to look inside the ear canal and see if there is too much wax, an infection, or any other problem. If wax needs to be removed, the doctor can do it safely. And if there are early signs of hearing issues, they can recommend further tests. Think of it this way. We take our children to the dentist to prevent cavities, not just to fix them when they're already painful. In the same way, regular ear checkups can prevent small problems from turning into big ones. Conclusion. So let's recap the 5 simple tips for cleaning children's ears safely. Don't use cotton swabs inside the ear canal. Keep ears dry after swimming or bathing. Use eardrops only if a doctor recommends them. Watch for warning signs like pain, fluid, or hearing difficulties. Get regular ear checkups. By following these tips, you can protect your child's ears, prevent infections, and make sure their hearing stays strong and healthy. Outro, thank you so much for watching today's video. If you found this information helpful, please give this video a thumbs up and share it with other parents who might need these tips. And don't forget to subscribe to our channel for more helpful advice on children's health and family well-being. Take care of your little ones, keep those ears safe, and I'll see you in the next video.